think we're at patient care number 9. I think we're at the last one. So contrast media, terms for contrast media, negative versus positive. Just remember your negative contrast is air. Positive contrast would be barium or water soluble, so it has to involve a contrast. KBP for the different ones, so iodinated contrast will be lower, so under 80 kBp. If you're doing, say, a double contrast enema with barium and air, you can stay around 90 kV, and then a single, which is barium only, will be at 110. If you see perforation, excuse me, or question perforation, you're going to always want to use your water-soluble contrast. If it's gastrographin or Omnipaque or whatever you're using, it has to be a water-soluble because you don't want to put barium into a questionable perforation situation. That was a good run. Anyways, ionic versus non-ionic. Ionic has higher osmolarity. It has greater risk for reaction than non-ionic contrast. When you're questioning the patient and obtaining history, the patient history is the best predictor for reaction. The highest chance for reaction is if they've had a reaction before. But realistically, about only 5% of patients experience some reaction. And then you have to judge the appropriateness. So depending on the patient condition, if they're questioning perforation, if there's risk for barium impaction, are they a neonate, then those kind of patients will require different types of contrast, possibly. Neonates or NICU babies, you're going to want to use probably the Venipuncture, which has the lowest chance of reaction. Patient's age and then patient's weight might come into play if you're having to do a contrast calculation. I think it's 0.5 ml per pound and not to exceed 100 mLs. Then there's always a possibility of a contrast reaction. So they can be a big range. It could be mild, moderate, or severe. And then prior contrast reactions is your biggest indication of possible reaction again. Local effects, oftentimes we'll see the extravasation, which will be in the tissue. If it's, sometimes it happens over in CT, then they'll bring them over for an x-ray of the arm to see if it's kind of stayed in the arm. Possibly air in the vein would be the air embolism. We don't want that, and hopefully that never happens. Systemic effects, so different types of shock. So I want you to make sure and go through your types of shock. Could you pick out from a definition which type of shock it was? There's also allergic reaction or anaphylaxis if they have hives, and make sure you know hives, the specific name for it, urticaria there. Lab values, so making sure to go through your patient's lab values prior to giving them the contrast. So checking BUN, creatinine, and the GFR. So BUN is the blood urea nitrogen test. It measures the amount of urea nitrogen that's in your blood. Normal range is 8 to 20. And then creatinine will measure how well your kidneys are performing. So normal range 0.7 to 1.2. And then GFR helps providers spot problems with your kidneys, including kidney disease. So it's the glomerular filtration rate, and normal is 90 20, sorry. GFR score below 60 will suggest a kidney disease. So their calculation also is by weight, 0.5 ml per pound of body weight to not exceed 100 ml. Symptoms of contrast reaction will vary from patient to patient, whether it's mild or severe, but they might start to just be restless, have a sense of apprehension. You might see a slight increase in pulse rate. Their pallor accompanied by weakness or change in thinking ability. They might have cold, clammy skin all of a sudden. Fall in blood pressure, itching, flushing, shortness of breath. So all signs of possible reactions. As a radiographer, you're required to respond appropriately and document appropriately. So mild reactions could just be nausea, vomiting, hives, something like that. You'll monitor and comfort the patient. If vomiting occurs, you're going to roll the patient to their side and make sure that they're able to vomit into a basin if possible. Again, document the patient's reaction. Moderate reactions are a little bit more severe. There's going to be excessive hives. There might be a rapid heart rate. Vomiting, you're going to want to call for assistance, prepare for administering an antihistamine, document the patient's reaction. Severe takes everything to sort of a higher and possibly life-threatening situation. So it's going to be possibly low blood pressure, possible cardiac arrest, loss of consciousness, blue skin, the cyanosis, difficulty breathing. You're going to want to prepare for administration of medication and assist with CPR, document everything, but you're going to need to call for some significant help for that reaction. So make sure you kind of know what's considered mild, moderate, severe. And this picture may help you. A lot of people are always like, I feel like vomiting is severe. Vomiting is no fun, but vomiting is usually, most of the time, not life-threatening in these types of situations. So for these, they consider vomiting to still be a mild reaction, and then, not life-threatening. So know the differences between the three and what you might see. Here's a list of possible medications or emergency medications that might be used, that you might have seen. Oops, sorry, I skipped that. But allergic reactions would be most often Benadryl, or you might see this Decadron. Arrhythmias, xylocaine or lidocaine, two different terms there. Edema, Lasix, cardiac arrest, or anaphylaxis would be epinephrine. Angina would be the nitroglycerin or nitro. You might have heard it in a shortened version. Spastic colon, glucagon. I don't know if you've ever done an ERCP where they had a kind of patient was spasming. They had to give the glucagon, kind of settle it down so they could get through the ERCP. Things like that. So just an example of different types of medications. Venipuncture. Just know your venipuncture basics. So there's 5 rights of drug administration. So do you have the right patient is number 1. Right patient, right drug, right amount, right route, right time. Those are your 5 rights. Never leave your patient alone in case of a possible reaction. You want to check your patient's pulse and blood pressure for all procedures before, multiple times during, and after. Document everything. If you've learned anything from this lesson, it's to document all the things. So, right drug, right patient, the right dosage, at the right time, at the right route. Venipuncture. So go through your venipuncture steps. Bolus injection would be an IV push. Infusion is a drip. Know the steps of the procedure in order. What kind of sites would you use for insertion of venous catheter for the needles? The antecubital vein is considered the most common. The accessory cephalic vein. Basilic vein is also the second most common, or the cephalic vein. So knowing your anatomy here would be helpful. And then angle for administration of injection. So 90, 45, 25 versus the 10 to 15. And I think that wraps up all of patient care.